We're moving on to the beginning of session one. I'm going to hand over now to our moderator for that session, Mr. Nicholas Granger. Over to you, Nick.
Thank you very much, Brianna. So good morning, colleagues, or good afternoon, depending on where you are viewing from. As Brianna would have mentioned, my name is Nick Granger, and I'm a Program Policy Officer with the World Food Program Caribbean Multi-Country Office, and I will be your moderator for our first session today, which is entitled Digitalization of Social Assistance Payments, Insights from Practice and Voices of Beneficiaries in the Caribbean. Now, this session will touch on the digitalization experiences from governments across the Caribbean, showcasing experiences in implementing various initiatives and including findings that address the following questions. The first question, what lessons have we learned in digitalizing social assistance payments programs? And secondly, what do women and men receiving social assistance digitally in the Caribbean think about the advantages it presents or the challenges that they face? We are joined today by three panelists who sit at the helm of this important transition and oversee social protection programs in their respective countries. I would like to first introduce our first speaker, representing the government of the Commonwealth of Dominica, Ms. Sylvanie Burton. She is the Permanent Secretary of the Ministry of Youth Development and Empowerment, Youth at Risk, Gender Affairs, Senior Security, and Dominicans with Disabilities. Our second presenter will represent the government of St. Lucia. Her name is Dr. Eurydice Delier, and she is the Deputy Director of Social Transformation at the Ministry of Equity, Social Justice and Empowerment. And our third and final presenter will represent the government of Haiti. He is Mr. Joseph Alexi. He is a senior official in charge of safety net operations at the Ministry of Labor and Social Affairs of Haiti. Mr. Alexi will be presenting in French, and his presentation will be translated with the assistance of Mr. Thomas de Breur, who is a program officer with the World Food Program based in Haiti. Now, for this session, we will allow for all the presenters to complete their presentations, and after we will then move on to the question and answer session. At this time, it is my pleasure to invite P.S. Sylvanie Burton to begin her presentation. Over to you, P.S. Burton.
Thank you, Nick, and a pleasant good morning to all the panelists as well as everyone who's listening, who has joined us on this panel discussion. The Commonwealth of Dominica has over the past few years instituted a number of social protection measures to assist the most vulnerable in our society in times of disasters. We have experiences in 2015 with Tropical Storm Erica, where about 95% of our GDP was affected and 3 communities had to be relocated. In 2017, Hurricane Maria dealt a serious destruction of approximately 226% of our GDP, from which we are still recovering. And in 2020 to the present, the impact of COVID-19 continues, and so social protection has played a critical role in assisting the most vulnerable in our society. At present, the government of Dominica has commissioned the development of a social protection policy to guide the sector and a social protection strategy to elaborate how this can be achieved. Post-Hurricane Maria, the government articulated its objective of building the first resilient nation, and all national objectives have been so aligned. Aligned with the national objective of building a resilient Dominica, this social protection policy emphasizes strengthened resilience with a particular focus on the poor and vulnerable, with social protection playing a critical role in this resilience and it's reaching those most at risk of decline in the face of economic challenges. More broadly, this will assist us in better targeting and greater reach through social assistance, more expansive coverage through social insurance schemes, including Social Security, access to tailored training and economic support within the context of robust labor markets, and support to improve livelihoods that will assist in strengthening social care networks and local government involvement in the service delivery that helps build resilience in neighborhoods and rural communities. Social assistance, based on the challenges facing the provision of assistance during and after disasters, we are of the opinion in Dominica that a multi-approach to the transfer of assistance to beneficiaries is what will work best for us. The multi-approach will include the provision of assistance to families through cash transfers, provision of supplies, and the digital transfer of assistance, as well as the digitalized reconciliation of cash assistance. The experience post-Hurricane Maria was one where cash on hand was of very little use to the beneficiaries or to any individual in Dominica. In planning and preparation for disasters, we have taken on board a multi-approach for delivery of assistance to all beneficiaries. The government of the Commonwealth of Dominica continues to be grateful to the World Food Programme for assisting with cash transfer grants to vulnerable families to cushion the impacts of the COVID-19 pandemic. Cash assistance was dispersed to all existing beneficiaries under the regular monthly public assistance program through an increase in their monthly cash allowance. Additionally, cash assistance was paid to the elderly not receiving monthly cash allowance from the 70 and over non-contributory pension program, small craft vendors, fish vendors, and fishermen who met the criteria. For my ministry, one of the greatest achievements of this cash transfer was the digitalization of both the registration of applicants who were not beneficiaries under the public assistance program and the digitization of the payment reconciliation for all beneficiaries. The platform used by the enumerators for registration enabled those who registered to be automatically registered on that platform and using a point system based on the criteria to be promptly analyzed. The 41 village council clerks were trained and provided with tablets to undertake the cash payments to all beneficiaries. Each payment envelope had a barcode, and upon payment, the information was electronically uploaded to the platform with identification, signature, or any other information required. This allowed for ease of reconciliation of all payments done. This program was done in collaboration with the Information Communication Telecommunication Unit of the Government of Dominica and the Audit Department of the Ministry of Finance. The information fed into their systems for tracking and verification of payments as it was done. Presently, the World Food Programme is assisting us with the establishment of a management information for all our social protection programs in Dominica. The Cabinet of Dominica has approved a steering committee to oversee the implementation of that MIS. The steering committee includes a cross-sector of government institutions, including the Statistical Division, the Ministry of Finance, and the Ministry of Planning. The Ministry of Finance is also working on the implementation of a digitization of payment and reconciliation for all beneficiaries of the 70 and over non-contributory social pension cash transfer program. And that is because they learned from us when we first implemented the reconciliation payment process. And we are exploring the possibility for collaboration with them, as well as incorporating that into the work of the ICT unit. We have also held discussions with other private sector stakeholders. For example, the Dominica Credit Union League has implemented the M-Ledger, or what you would call M-Money, which is a digital financial solution or a mobile wallet. And many of the beneficiaries of our programs, our social protection programs, are members of the credit unions or utilize the services of the credit unions. And so this can be explored to allow for digital payments to beneficiaries utilizing the mobile wallet and utilizing their cell phones. That unit, that mobile wallet, can be used at the point of sale for any purchases that they would have to do or for payment of their bills. Of course, the digital reconciliation payment had some challenges, had quite a number of challenges, both the payment and the reconciliation, the registration and the reconciliation of payments. Based on the selection criteria, applicants who were approved for assistance had to be verified by a community leader. And in some instances, this proved to be a challenge. Another challenge that we had was the timely processing of payments and the number of layers prior to receipt of the assistance, especially for beneficiaries using a rural credit union. That was of concern. The funds would be processed by the government treasury through the National Bank, then to the National Credit Union, processed by the National Credit Union, and finally sent to the accounts of the paying credit union. And so this created a time lapse for us. The complaints mechanism, we realize, should be more transparent. We think that this may have to be done externally of the ministry to ensure that complaints are addressed in a timely manner. The supervisors of the village councils, who are the first line of auditors for finances received by the village councils, we realize that they should be trained in the use of digital reconciliation of payments in order to have smooth auditing of the records. We also experience some issues in terms of access to internet by the village councils for the timely transfer of information and use of the digital reconciliation. This was identified as an issue, and so we facilitated this process by providing the council clerks with data plans, both for informing beneficiaries and for uploading the information. At this point, Nick, I will stop and I will answer any questions that may be posed to me. Thank you.
Thank you very much, P.S. Burton, for your presentation. I'll allow the other presenters to finish first before we start the question and answers. Very encouraging to hear the steps that Dominica is taking in terms of recognizing the need for a multi-country approach, multi-sector approach, but also it's encouraging to hear the again partnerships across ministries as well as the involvement of the credit union to see how best we can move forward the processes in Dominica. I now invite our second speaker, Dr. Eurydice Delaire, to begin her presentation. Over to you, Dr. Delaire.
Good morning, everyone. Would you allow me to share my screen, please? Good morning.
Good morning.
Can I go ahead now?
Yes, you may proceed, Dr. Delaire. We can see your screen.
Thank you very much. The social protection system in St. Lucia has been supporting vulnerable persons for many years. And like many other Caribbean territories, we provide social assistance in the form of cash transfers to varying groups of poor and needy people. We have a child disability grant. We provide vouchers to persons living with HIV, the public assistance program, and many other relief programs. However, after Hurricane Elsa, and even with this pandemic, we saw the underbelly of our system in terms of our inability to respond quickly to the growing demands of our existing beneficiaries and cater for the increased number of persons requiring assistance. There was also the issue of effecting payments to persons in a timely fashion and the unavailability of services of the financial institutions after the hurricane and even during the lockdown to allow persons to access their funds. So after Hurricane Elsa, the ministry, with the assistance of the World Food Program, grabbed the opportunity to make its social protection system more adaptive to shocks and analyze the factors that make people vulnerable to the impacts of hazards and limit their capabilities to handle these impacts on their own. So St. Lucia therefore took a holistic approach to review its social protection system by doing the following. We developed a vulnerability index, which is a composite tool that rates a person's or household's priority for assistance from three indicators. We looked at the socioeconomic deprivation, resilience capacity, and the hazard susceptibility. The application of the vulnerability index is a new option for analyzing which households were in need of support in the event of disasters or to inform support ahead of them. The index was also combined with the SLNet 3.0, and the SLNet 3.0 is a proximins test that we use as our main targeting tool for social assistance. Having identified the persons for assistance, several payment options were presented to beneficiaries. Also, in collaboration with the World Food Programme, the Ministry of Equity was able to put together an operations manual to standardize the process and close any operational gaps in its shock responsive social protection system within the framework of the Social Assistance Programme. And it is our hope that this operations manual will help inform elements related to responding and adapting to shocks. Through joint collaboration with the World Bank and the WFP, St. Lucia is in the process of reviewing the social protection policy and legislation. And last week, we completed the consultation stages for each with key stakeholders. We are also in the process of contracting the consultant for our social information system, which includes the establishment of a social registry and beneficiaries registry under the Human Capital Resilience Program and disaster risk management information systems, discussing issues related to accessibility, sharing protocols, data collection mechanisms, data relevance and accuracy, and security and privacy protocols. We have also contracted consultants for our graduation and communication strategies, and both of which should be completed in the coming weeks. In terms of delivery mechanisms, the ministry has been for a long time making cash transfers to persons on the public assistance program. But, you know, society is dynamic, and we think that the time has come to introduce new modalities and payment options to our beneficiaries. And this area here will be the main focus of my discussion for the rest of my time. So following Hurricane Elsa, the WFP and the ministry launched a cash assistance program to support vulnerable people impacted and pilot-tailored shock responsive measures. The pilot tested a new vulnerability assessment tool and payment mechanism called Penny Pinch. So what is Penny Pinch all about? Penny Pinch is St. Lucia's first and only licensed mobile wallet. Using the mobile wallet app, beneficiaries can make instant payments to hundreds of businesses island-wide, pay all bills, or send or receive money between Penny Pinch accounts. There are also, Penny Pinch is a licensed Class A under the Money Services Business Act and regulated fintech company based in St. Lucia. The company developed its namesake mobile application initially for customers to receive rewards, cashbacks, and coupons from a variety of businesses. But now we have seen a development. It's now a digital financing platform that allows for peer-to-peer transfers, bill payments, business payments, and so on. And this is all done via a verified wallet account where users may conduct transactions. How many persons from the ministry signed on to Penny Pension? How many have remained thus far? The goal of the pilot was to establish a foundation for the approach that will be taken when expanding the Penny Pinch ecosystem to a larger audience of the vulnerability group. Penny Pinch onboarded 20 individuals through all digital means for the purpose of the pilot project. Due to the pilot being a one-off transaction, the ministry hopes to expand the program to a much larger audience while retaining its current clientele as we increase the number of vulnerable persons who will engage Penny Pinch's services. Approximately 275 persons benefited financially from the WFP Hurricane Elsa program. From the disaggregation, we can see that most persons opted to receive payments through the credit unions, and the lowest option was the mobile money. The 2% represents the 20 persons who opted for penny pinch. Based on the data also, some persons had multiple accounts, and most persons who selected the mobile app also had bank or credit union accounts. Most of the participants who agreed to use penny pinch were females. And out of the 20 persons, the majority in the age group were between 25 to 45 and 45 to 55. So we're going to now look at, the advantages, and the responses are based on what the client, the beneficiaries themselves told us in our focus group discussions. The current users are enthusiastic about the penny pinch application and recommend future use and more features, that is payment options. Having the ability to pay through the application is regarded as a major convenience, and there is clear demand to expand that ability to many more vendors, particularly supermarkets and drugstores and some more petrol stations. The beneficiaries were not too interested in cash withdrawals because they would have to wait in long lines to do so, particularly in the credit unions. There was an additional feeling of safety when having money on the phone instead of having to carry physical cash in the pocket after withdrawal. Beneficiaries expressed feelings of insecurity, that is, fear of being robbed and so on, and they lamented the increasing crime rates as a main reason for this preference. Despite all the challenges experienced by the beneficiaries, they are still willing to use or continue to use penny pinch application. They also seem not to mind if a small fee was applied due to the convenience and security. This application is convenient for beneficiaries who have constraints with physical mobility. Example, the inability to stand and wait in long lines to withdraw funds or conduct payments. The interaction with the Ministry of Equity was also very satisfying, and the customer service appeared engaging. Interviewees were impressed that they received multiple calls, that is, and someone, they believed that, we cared about them receiving the funds. So there was constant dialogue with the beneficiaries. And of course, there were limitations. Some of the beneficiaries were not tech savvy and therefore required a lot of hand holding to walk them through their registration process. For some, their mobile devices had limited storage space, making it impossible to install the Penny Pinch app as the device's specs were lower than the minimum requirements. Most clients also were unsuccessful at the facial recognition stage of the Penny Pinch app and could not continue with registering their account. Beneficiaries with no bank accounts could not cash out, and perhaps this is one of the main limitations. And most beneficiaries wanted the money to buy groceries at the supermarket. At that time, the supermarket had not yet partnered with Penny Pinch, so therefore some persons had to cash out. For a few beneficiaries, the cash did not land on the penny pinch application, despite the expectation, but on their credit union account and without their prior knowledge. So these were just, teething issues that we had to deal with. And although we set up a feedback hotline, many of the beneficiaries did not make use of it. And perhaps it's a fault of the ministry. Some of them were unaware of its existence. But we learned several lessons from this experience. And one of them is that we need to strengthen our internal data management system to raise awareness and communicate with beneficiaries. There also needs to be a grievance mechanism process to ensure that recipients receive cash according to their expectations and preferred channel, and that they understand what the assistance is for, where it is from, and to whom to turn to in case of issues. Clearly, Penny Pinch must increase their payment features to include supermarkets, drugstores, and petrol stations to enable wider use and convenience of the app. Very important to us, we need to add credit unions to the application to enable wider app coverage and options for use, including cash withdrawals or transfers. As the research shows, most participants prefer to use the credit unions to banks. There should be a mechanism in place for instant notifications when cash is transferred to a recipient's account. The transfer should also be appropriately labeled or described to enhance awareness among beneficiaries of the source of funds. Beneficiaries recommended a light version of penny pinch for elderly, or one that can be spoken to or that enables a voice feature to avoid need for recording or typing. Some beneficiaries prefer not to use penny pinch, but rather credit unions because of the perceived temptation for easy access to money. And some of them prefer to save some of that money instead of having easy access to it on their phones. On the other hand, we have some beneficiaries who prefer penny pinch to cash withdrawals because with penny pinch, as you said, you just pay. There is no hassle and you don't withdraw extra money, which translates to another way of managing their own temptations. No preliminary conclusions can be derived on the difference in savings behavior and barriers between men and women. And one of the reasons is that we had several more women than men among our participants. Beneficiaries are generally unaware of what an e-wallet is, but are familiar with penny pinch as a payment method. With the exception of one beneficiary who seemed generally very plugged in, but generally there is no awareness of Dcash or any of these other virtual areas. In terms of our way forward, through this pilot and experience, Pennypinch developers are now prepared to expand the program to a larger audience. Pennypinch is looking to re-engage the Ministry of Equity in the near future to test the rollout of new essential products that the ministry's beneficiaries can take advantage of, such as cash deposits, mobile top-ups, and the ability to receive MoneyGram and Western Union transfers directly to their smartphones. The ministry is hopeful to introduce penny pinch to its other constituents within the social assistance program. And this is the end of my presentation. I await further questions. Thank you.
Thank you very much, Dr. Dallaire, for your presentation on Penny Pinch. Very interesting to hear both the opportunities in terms of identifying the need for additional vendors to be placed, but also some of the limitations, again, that are not only unique, I believe, to Penny Pinch, but also you would see some of these limitations, as P.S. Burton would have mentioned, the M. mobile wallet app in Dominica. Thank you again, and I would allow for us to go to the next presentation before we go on to the question and answer session. So therefore, at this time, it's my pleasure now to introduce Mr. Joseph Alexi, Senior Official in charge of Safety Net Operations at the Ministry of Labor and Social Affairs of Haiti, to begin his presentation. Over to you, Mr. Alexi.
Bonjour tout le monde. Thomas, tu es là?
Oui, je suis là, allez-y. Monsieur Alexis, on vous écoute.
Bonjour tout le monde et je voudrais commencer par remercier les initiateurs de cette assise sur la numérisation des paiements et des assistances sociales. Et ce serait un plaisir pour nous de partager l'expérience d'Haïti en la matière.
So my name is Thomas and I will be in charge of the translation today. So Mr. Alexi is thanking the organizer of the events and will start sharing information about the Haitian experience.
Ok, comme il nous a été demandé, on a organisé notre présentation de ce matin autour des deux questions principales en vue de partager les leçons que nous avons tirées de la numérisation des programmes de paiement d'assistance sociale en Haïti. Et ensuite, nous allons aussi partager avec vous ce que pensent les femmes et les hommes recevant une aide sociale numérique en Haïti en termes d'avantages et de défis en utilisant les services de paiement numérique.
So you have here the key question, sorry for the presentation today. So the question have been already given to you and you can see them on the screen now. Allez-y, Monsieur Alexis.
Globalement, Haïti a commencé avec un ensemble d'expériences, un ensemble de projets où on voulait intégrer la numérisation des paiements de l'assistance sociale. Et particulièrement, nous aimerions attirer l'attention sur deux principales initiatives, à savoir le projet Courir la vie et le projet de réponse COVID du gouvernement haïtien.
So Haiti has already been experimenting some previous experiences with the digitalization of cash transfer. And today, Mr. Alexis would like to draw your attention on two specific examples, which has been the Corée safety net and the COVID response.
Parlant de courir la vie, nous devons dire qu'il s'agissait d'un projet d'assistance sociale qui voulait combattre l'insécurité alimentaire et résoudre des problèmes nutritionnels.
Regarding Corée, it was a social assistance program that was looking to solve some food security issues.
Il s'agissait de projets de transfert monétaire conditionnel.
Made of conditional cash transfers.
Qui visait à donner d'abord deux types de coupons. Un coupon normal, papier, et un coupon électronique pour permettre aux bénéficiaires de pouvoir acheter des produits frais et des produits secs pour la consommation.
And cash transfer were made out of two transfer modalities. One was paper voucher and another one was e-voucher that would allow the beneficiaries to buy some food items.
La partie qui nous intéresse aujourd'hui, c'est surtout les coupons électroniques que l'on faisait à travers un système qu'on appelait Tipago.
The interesting part for us is the e-voucher that was done through a system named Tipago.
Il s'agissait de produits de la Digicel qui permettaient aux bénéficiaires d'acheter un ensemble de produits alimentaires secs à travers un réseau de vendeurs désignés.
It was a product from the Digicel company, which is the main mobile phone operator in the country that would allow beneficiaries to buy food products in some predefined retail stores.
Et dans le cadre de ce produit, ce qu'on faisait, c'est que la compagnie a transmis un ensemble de codes liés à des comptes virtuels accessibles depuis leur téléphone qui permettaient aux bénéficiaires d'acheter des produits entre les mains des vendeurs et de payer à travers le code, à travers le voucher électronique.
In that case, it was a system with codes where the beneficiary was receiving a code on his cell phone that would allow him to make his purchase at these pre-selected retail stores.
Il y avait certainement des difficultés, mais c'est un système quand même qui a permis qui a facilité les transferts plutôt fiables et automatiques de fonds et facilité aussi les paiements des produits achetés entre les bénéficiaires et les fournisseurs et qui a facilité aussi le suivi des transactions.
The system faced some difficulties, but it was quite efficient and quite reliable systems in terms of following up with the different payments, making the transactions, and following up on the funds disbursements.
Et une bonne chose, c'est que tous ces transferts ont été réalisés sans transfert d'argent en main propre entre les bénéficiaires et les fournisseurs.
And there was not cash in hands, no transfer of cash between the beneficiaries and the retailers.
Et comme je disais au départ, il y avait quand même des faiblesses puisque on peut noter le fait qu'il y avait une couverture et des services électroniques pas assez forte et et il y avait un problème de stabilité des services électroniques aussi, des services téléphoniques.
Among the weaknesses, there was the lack of coverage of the services and the lack of stability of the networks.
Oui, puisque en réalité, ce projet, ces transferts ont été réalisés aussi dans des communes ou bien des endroits assez éloignés en Haïti.
Since those transfers were already done in some rural, remote areas of Haiti.
Et toutefois, un autre aspect particulier à prendre en compte est qu'il y avait une faible connaissance des bénéficiaires sur la manière d'utiliser les coupons électroniques.
And there was also a very low knowledge of the beneficiaries of how to use electronic vouchers.
La deuxième expérience sur laquelle je voudrais attirer votre attention, c'est l'expérience qu'on a fait en termes de réponse au Covid.
The second experience was with the COVID response.
Cette expérience a été mise en œuvre par le FAES, un organisme de l'État haïtien.
Implemented by FAES, another Haitian public institutions.
Tout ce qu'on voulait faire, c'est que le gouvernement avait décidé de réaliser un ensemble de transferts électroniques, de transferts monétaires de façon électronique pour environ 6 000 familles haïtiennes vulnérables.
At that time, so the government decided to make some digital payments to 6,000 Haitian families.
Et là, le service qu'on allait utiliser est le service Mon Cash de la compagnie Digitalisation.
Through the Moncash service of the digital phone company.
Pour le ciblage, au départ, on voulait utiliser le CIMAS, qui est le système d'information du ministère des Affaires sociales et du Travail, qui dispose d'un ensemble d'informations sur la vulnérabilité des ménages au niveau d'Haïti.
Regarding the targeting process, they first considered using the CMAS, which is the National Social Registry, which is in the hands of the Ministry of Social Affairs and Labor of Haiti.
Toutefois, en voulant utiliser le CIMAS, on a dû faire face à un ensemble de difficultés pour pouvoir toucher l'ensemble des communautés qu'on voulait toucher, puisque le CIMAS n'a pas encore eu de couverture sur l'ensemble du territoire national.
However, they realized that they were facing some difficulties to reach some of the communities that were affected, since the CMAS social registry doesn't have a national coverage yet.
En ce sens, on a dû faire un ciblage communautaire en demandant aux autorités locales de fournir des listes de bénéficiaires potentiels.
So that they decided to use a community targeting system with local leaders providing list of beneficiaries.
Là encore, nous avons tiré des leçons puisque, en effet, le service Mon Cash est disponible, mais la pénétration n'a pas encore été suffisamment forte.
Some of the lessons learned from that experience is that the Moncash e-money system is available, but the rate of penetration is not high enough. The coverage is not high enough.
Et en ce sens, on a reçu, par exemple, un ensemble de numéros pour les ménages, on a reçu un ensemble de numéros de téléphone qui, en réalité, ne disposaient pas de compte Mon Cash. Et il y avait aussi des problèmes de liaison entre les noms des bénéficiaires, les numéros de téléphone.
Mhm. And in that sense, one of the difficulty is that they were receiving a list of beneficiaries of people that didn't have any Moncash account, and there were a lot of mismatch between the list received and the phone numbers, the official phone numbers registered by the phone company.
En ce sens, on a pu servir seulement 20% des bénéficiaires qu'on voulait servir à travers ce projet.
So that only 20% of the beneficiaries that were supposed to receive the transfer actually received their transfer.
Pour pouvoir aller en profondeur de cette présentation, je vais maintenant vous parler du projet que nous avons actuellement, qu'on appelle Cléry Chemin.
So now we're going to go more in depth into this presentation, talking about the actual project implemented by the ministry, which is Clair et Chemin.
C'est un projet financé par la Banque mondiale, implémenté par le ministère des Affaires sociales et du Travail, avec un appui technique du Programme alimentaire mondial.
It's a safety net. It's a project funded by the World Bank, implemented by the ministry, and with the technical support of the World Food Programme.
Financé avec un montant de 75 millions de dollars, le projet vise à réaliser des transferts monétaires à environ 18 000 ménages, ciblés en fonction de leur degré de vulnérabilité.
It is funded with $75 million and will reach 18,000 households targeting related to the level of vulnerability.
Dans le cadre de ce projet, nous aurons à faire des transferts monétaires inconditionnels et ce sera accompagné de l'ensemble de mesures d'accompagnement en termes d'inclusion financière et de nutrition.
In this case, the safety net consists of non-conditional cash transfer together with some additional activities related to health, nutrition, and economic and financial inclusion.
Le ciblage est réalisé à travers le système d'information du ministère des Affaires sociales et du Travail en choisissant les ménages les plus vulnérables en fonction de trois critères. Il faut d'abord comme base que les ménages soient très vulnérables. Ensuite, au niveau de ces ménages vulnérables, il faut qu'il y ait soit une femme enceinte, soit un enfant de moins de 5 ans, soit une personne handicapée.
Targeting is made through three criteria. So the household has to be very vulnerable and has to belong to one of the following categories. I couldn't take note of all the categories, but it's pregnant women or family with young children or family with a person with disability, I think.
Et il y a trois aspects particuliers qui nous intéressent en termes d'indicateurs de qualité. Il faut qu'à travers les transferts monétaires et les mesures d'accompagnement, on aboutisse à faire de l'inclusion financière pour les ménages bénéficiaires. Il faut qu'on arrive à faire des transferts électroniques, des paiements électroniques, et cibler également une majorité de femmes, c'est-à-dire pour arriver à l'autonomisation des femmes.
There are three aspects of particular importance for this presentation today, which is that the social safety net has to promote financial inclusion, that the transfer has to be mainly done through a digital mechanism, and sorry, the third one was the targeting has to
Autonomisation des
be
femmes.
in priority with women. Sorry.
Nous avons commencé avec les paiements dans le cadre de ce projet au cours du mois de mai 2022.
Payment started in May 2022.
Et nous avons donné le choix au départ aux bénéficiaires entre des paiements par cash en enveloppe ou des paiements électroniques.
And the choice was given to beneficiaries between cash in envelope and e-money payment.
Toutefois, on n'a pas donné suffisamment d'informations et d'incitatifs pour pousser les ménages à choisir les paiements électroniques.
However, we didn't give enough incentives of information to push beneficiaries to select e-money. So they could choose, and there was no incentive or additional information regarding e-money given.
Et pour les premiers paiements réalisés au niveau de deux communes, on a pu réaliser seulement 3% de paiements électroniques contre 97% de paiements cash en enveloppe.
So that in the first group of beneficiaries, only 3% of them received the first transfer through e-money and 97% through cash in envelope.
Ce qui, d'une certaine manière, nous pousse un peu loin de notre objectif d'inclure les bénéficiaires dans un circuit financier formel.
Which makes that we are a bit far from the objectives, that is to push beneficiaries towards formal financial circuits.
En ce sens, on a dû penser à analyser la situation pour voir quelles sont les barrières spécifiques à, à lever de manière à faciliter l'utilisation des transferts électroniques beaucoup plus par les ménages bénéficiaires.
So that we were asked to analyze the situation and, in particular, the barriers that were preventing beneficiaries and women to opt for e-money and for more inclusive financial means, financial, let's say, cash transfer mechanism.
Et là, dans ce cas spécifique, nous avons fait quelques analyses en interne par rapport à la réalité du projet, mais nous avons croisé ces données avec une étude qui a été réalisée à travers par le PAM avec un financement de la Gates Foundation.
So that the ministry made some internal analysis and they also use some of the information collected through the Gates Foundation projects and implemented by WFP.
Et là, on a pu comprendre que les problèmes étaient déjà identifiés. Et pour mieux vous aider à comprendre, je vais partager avec vous quelques informations concernant cette étude qui a été réalisée à travers la Gates Foundation.
Mr. Alexis will share with you some of the problems identified and the information that has been collecting through this project.
En principe, dans le cadre de cette étude, on avait interrogé environ 500 personnes, dont 350 femmes.
So during this study, they have been talking to 500 persons, among them 350 women.
38% de ces femmes possèdent un compte mon cash en leur nom, mais contrairement aux hommes qui représentent 46% qui disposent d'un compte mon cash.
38% of women declare to have an e-money account, a Moncash account, compared to 46% of men.
Mais la chose, c'est que si vous regardez dans le tableau, vous allez voir qu'en termes d'utilisation, le niveau est assez bas pour l'utilisation que les bénéficiaires ont fait de leur compte mon cash.
But you will see from the table that the level of use, the frequency of use of these services is quite low.
Et là, vous allez voir qu'il y avait 4% de femmes et 6% d'hommes qui ont fait des dépôts et ou ont gardé de l'argent sur leur compte mon cash, sur leur compte électronique.
With only 4 and 6% of women and men that have deposit and save money on their e-money account.
Et vous allez voir qu'il y avait 6% de femmes et 9% d'hommes qui ont fait des retraits.
And respectively 6 and 9% of women and men that have cashed out money from their e-money account.
Mais pour les autres services comme faire des transferts P2P ou payer des services dans un magasin ou payer des services publics ou acheter un service d'assurance, il n'y avait presque pas d'utilisation en ce sens.
But for all the other services, there were barely no use of those services, like to make transfer to other people, pay public services, make payments in shop, or access insurance products.
Ceci explique quelque part que les services électroniques ne sont pas bien connus et sont sous-utilisés.
That explains that all the services are not well known and are not used enough and properly.
Mais toutefois, pour la partie des bénéficiaires qui ont utilisé les services Mon Cash, 76% se sont déclarés plutôt satisfaits.
However, among the Moncash users, 76% have declared themselves as satisfied of the quality of the service.
Mais pour les autres, ceux qui ne l'utilisent pas, ils parlent de l'accès limité à un téléphone portable, le peu de connaissances sur le fonctionnement de la plateforme électronique Mon Cash et les difficultés récurrentes rencontrées avec les réseaux d'agents Mon Cash lors des retraits.
And for people that do not use them, they would mention that as main barriers, the lack of access to cell phones, the lack of knowledge regarding, lack of information regarding Moncash products, and the difficulties that they faced while dealing with the networks of agents.
Mais un autre chiffre important à retenir, c'est que 68% pensent qu'il existe un risque de vol avec, avec, avec ce produit, à savoir le service Mon Cash.
Also important to mention that 68% of the people interviewed declared that there is a risk of theft related to this product, e-money, this e-money product.
Et enfin, il faut dire aussi que seulement 7% des femmes répondant, répondant au questionnaire dans le cadre de cette étude ont souhaité recevoir le transfert monétaire à travers Mon Cash.
And only 7% of women declare that they were willing to receive the cash transfer through the Moncash services.
Ceci dit qu'il y a un travail important à faire en termes d'appropriation et des services de transfert électronique ou de e-money au niveau national.
So that you can see that there is a lot of work to do in terms of ownership of the systems and at the national level.
Maintenant, je pense que nous pouvons regarder ensemble les défis auxquels font face le gouvernement haïtien dans sa volonté de faire des transferts électroniques, de transferts sociaux de manière électronique aux familles bénéficiaires, aux ménages bénéficiaires.
Now we will see some of the main challenges that the government is facing while trying to do G2P transfer through e-money.
La première chose, c'est que nous avons une régulation, c'est-à-dire à très peu développée. Il n'y a pas longtemps que nous avons eu une première circulaire de la Banque centrale qui essaie de réglementer des transferts électroniques en Haïti.
The first thing is that the regulation is not very well developed. It's been until very soon that there was no regulation of e-transfer, e-money in Haiti.
Nous faisons face aussi à des faibles niveaux de développement de l'écosystème de paiement. Il y a absence d'interopérabilité entre les banques, c'est-à-dire on commence à développer un système, mais ce n'est pas encore très, très efficace.
There is also a low level of development of the ecosystem for payments. For instance, interoperability between the banks is not very well developed in Haiti.
Il n'y a pas vraiment un commutateur national pour l'instant ou de système de paiement rapide pour les agents de détail, c'est-à-dire les magasins et les petites banques.
There is no fast payment system for small shops, retail shops, banks, etc.
Et les défis aussi existent en termes de réseau de communication qui est très limité, avec un niveau de qualité très assez basse dans certaines zones, et la sécurité aussi pour la prise en charge des paiements aux bénéficiaires.
Also, some issues with communication networks that is very limited in some areas with some lack of network and some security issues as well.
Ben, la partie la plus cocasse, c'est que nous avons aussi encore mal d'approvisionnement d'électricité pour la recharge des téléphones cellulaires.
Mm-hmm. And another issue has to do with in some areas the electricity cut. That is a big issue with the cell phone to charge the cell phones.
Le deuxième aspect des challenges aussi, c'est qu'il n'y a pas suffisamment de compétition entre les fournisseurs de services. On est presque dans une situation de monopole.
Another challenge is the lack of competency between service providers. We are almost in a situation of monopoly.
C'est le cas, par exemple, comme la Digicel qui bénéficie d'une situation de monopole dans l'ensemble de la région. Et c'est aussi une situation de monopole pour les paiements électroniques en Haïti.
It's already the case of the Digital, the phone company that has a monopoly in the region, and also for e-money since it's the same company. So the cash product is from the same company.
Pour l'instant, il y a d'autres acteurs qui essaient de se pointer pour fournir des services, mais les services sont encore à des phases initiales et on ne peut pas, pour l'instant, on ne peut pas encore compter sur leur qualité pour les utiliser.
Other actors are trying to enter the market, but the products are at a very initial stage. What would you tell us about this?
Et au niveau
Monsieur
des
Alexis,
utilisateurs,
go ahead. Allez-y, Monsieur Alexis.
au niveau des utilisateurs, nous avons aussi un problème de gestion des identités où nous avons beaucoup de personnes qui disposent de SIM card, de téléphone et de numéros de téléphone, mais qui ne sont pas liés à leur identité. C'est un problème qu'on est en train de résoudre.
There is also an issue at the users level with the identity management, since many people have SIM cards that are not related to their identity. So it's an issue that they are now trying to solve.
Et deuxième aspect par rapport à cette question d'identité, c'est que il y a deux types de wallets. C'est-à-dire pour le mini wallet, le bénéficiaire n'a pas vraiment besoin d'une pièce d'identité fixe. Mais après, pour le big wallet, il faut que le bénéficiaire ait une pièce d'identité, ce qui n'est pas toujours le cas en Haïti.
There are actually two types of wallets. The regulation defined two types of wallets. The small wallet doesn't require any ID, but we face this issue with the SIM cards. And there is a big wallet that has more KYC, and so people need an ID, but it's not that common in Haiti. It's not everyone has an ID in Haiti.
Et il faut aussi retenir que en raison de la faible qualité des services, il y a un taux de changement de SIM et de SIM card chez les utilisateurs assez élevé.
And due to the low quality of the services, the rate of turnover of the SIM card is very high, which is a big issue as well.
Et puis, comme nous avions dit aussi, les services sont encore à ses débuts. Si les compagnies téléphoniques arrivent à toucher pratiquement tous les niveaux nationaux, souvent fois avec des services 2G.
Désolé, monsieur Alexis, juste on me demande qu'on doit accélérer la présentation parce qu'on a déjà dépassé le temps. Donc,
Okay.
essayons d'aller un petit peu plus vite.
On va terminer rapidement. Oui.
Ouais,
Donc,
avec les agents peut-être.
je disais qu'au niveau des agents, il y a aussi un problème de disponibilité des agents, des agents de paiement au niveau des zones rurales reculées.
In terms of the network of agents, one of the issues is the lack of availability in most remote rural areas.
Donc, maintenant, qu'est-ce que nous tentons de faire pour essayer de résoudre ces problèmes, pour faire face à ces challenges?
No, what we are trying to do, the solutions proposed to fix these challenges.
La première chose, c'est que nous essayons de pousser la compétition et à travers ce projet pour faire ressortir le business case, encourager toutes les compagnies à développer leurs services de paiement électronique.
So the third thing is that we are trying to foster competition by encouraging all the company to develop their own e-money systems.
Ben, nous travaillons aussi avec la compagnie Digicel qui a déjà son service fonctionnel pour voir comment on peut améliorer les services.
And we are also working with the digital phone company that already has his service operating ongoing to try to improve the quality of the service.
Nous encourageons la Digicel à donner des incitatifs aux bénéficiaires
We are asking them to give beneficiaries some incentives
Nous encourageons aussi la compagnie de voir comment on peut aider les bénéficiaires à ouvrir des comptes Mon Cash, des comptes électroniques et aussi à passer de mini wallet à big wallet.
And we are asking the digital company to support our effort by helping beneficiaries to open some e-wallets, small and big wallets.
Et nous essayons de voir avec la Digicel comment on peut utiliser des, des modalités alternatives comme l'envoi d'argent électronique sur téléphone à travers des codes USSD.
And we are also trying to see how we can use alternative transfer modalities like the use of USSD on the cell phones, working with codes on the cell phones.
C'est-à-dire des transferts sans avoir besoin d'avoir un compte particulier.
Which means transfer without needing a specific account.
Et maintenant, pour les ménages bénéficiaires, nous tentons de voir comment nous pouvons améliorer les messages de sensibilisation pour aider les bénéficiaires à mieux comprendre les services et les encourager à mieux les utiliser.
We are also seeing how to have some key messages that we can uh, diffuse to our beneficiaries to help them to understand the services and better use them.
Et une des mesures additionnelles que nous essayons de prendre encore, c'est de voir comment on peut connecter notre système de gestion des plaintes et le système de gestion des plaintes que nous utilisons pour le projet, pour l'instant, celui du PAM, nous essayons de connecter avec le hotline de Digicel pour pouvoir porter les plaintes par rapport aux problèmes existants sur les transferts électroniques.
And another aspect is to connect the hotlines of both the social safety net and the Digicel so that we can quickly move the complaints between the two, and so that those complaints can be treated, attended as soon as possible.
Maintenant, je pense que nous pourrons répondre à donner plus d'informations si vous avez des questions. Merci de nous avoir écoutés. La présentation a été un peu longue puisque nous sommes deux à le faire en français et en anglais.
Yeah, and so that's it for the presentation today, and we are open to your question. And sorry for having been a bit long, but we were two people talking, so that can partially explain why we've been speaking a bit longer than the rest. Thank you very much.
Thank you very much, Mr. Alexi and Mr. De Boer for the presentation. No problem at all with the extra time. At this point, I would now like to open the floor to questions from the audience. Please feel free to raise your hand, or you can open your mic and, and feel free to ask your questions. Again, if you have any questions for PS Burton, Dr. Delaire, or Mr. Alexi, feel free to type in the chat to ask a question, or you can unmute your mic. Okay, that looks like, is it Danuta I'm seeing? Please feel free to unmute your mic.
Okay, thank you. Yeah, good morning, everyone, and thank you for the presentation. Yeah, my name is Danuta. I'm from Guyana, and over the past years, I'm part of Haiti support group, who has been lending different kinds of assistance to Haitians in Guyana who have been experiencing a number of problems. But on this question, I got in a bit late, so please excuse that this might have already been said. But in relation to the population of Haiti, what percentage of persons are potentially or are targeted to benefit from this program? And yeah, so that is my first question. And um, could you say right now, if possible, what is the level of need for such assistance in Haiti? Because it is well known the levels of poverty and the deteriorating political, social, and environmental state of Haiti. Yeah, so those two questions, and yeah, the reach of it, what percentage of the Haitian population are benefiting or will be benefiting from these services. Thank you.
Um, Mr. DeBur or Mr. Alexi, do you care to
Oui.
respond?
Alors, je vais traduire. Monsieur
Je,
Alexis, vous avez la
je,
réponse
je
ou...
pense,
Oui,
ouais, je pense
allez-y.
avoir compris. Oui, et merci pour la question d'Ennota. Et pour la première question par rapport au pourcentage de population ciblée, nous devons dire qu'il s'agit d'un projet pilote qui, qui touche un département sur 10 d'Haïti et qui envisage de desservir environ 18 000 ménages du département de la Gandas, de ce département.
So Monsieur Alexis is saying that it's still regarding the project that has been presented, is still a pilot project that is only reaching one of the 10 Haitian departments, which is the department of Grandance, reaching a total of 18,000 households.
Et dans le cadre de ce projet, ce que nous souhaitons, l'objectif aussi, c'est de pouvoir profiter de cette expérience pour mettre en place un système, un système de protection sociale capable de répondre aux besoins de l'ensemble des familles vulnérables d'Haïti.
And they are taking advantage of the experience to test a safety net, to test this new experience for a social safety nets that would be later extended at the national level.
Par rapport à la deuxième question pour le niveau des besoins, c'est que nous avons dû faire le choix en fonction de deux critères principaux. D'abord, un critère et un ciblage géographique pour choisir un département très vulnérable qui a été affecté à la fois par le cyclone Mathieu et affecté par le tremblement de terre du 14 août 2021.
Regarding the level of needs, so your second question, so they've been using various criteria. What is a geographic targeting? And they have selected the department that had been hit by Hurricane Matthew and by the earthquake of August 2021.
Et nous avons aussi utilisé le système d'information du ministère pour choisir les ménages très vulnérables comme bénéficiaires.
And they also have used the ministry's information system to select beneficiaries with the highest level of vulnerability.
Ceci dit, on a laissé la catégorie des mi-vulnérables et la catégorie des vulnérables pour passer aux très vulnérables.
So they have been focusing on the most vulnerable and not on the, what do you mean, mi vulnerable? So yeah, you focus on the most vulnerable layer of the population, let's say.
Ceci dit que c'est un projet qui doit répondre à des besoins très spécifiques.
Which means it's a project that has to respond to very specific needs.
J'espère avoir répondu aux questions, même si je n'ai pas vraiment donné de chiffres très précis.
Mr. Alexei hopes he answered your question, even if he didn't give any precise figures.
Thank you very much, Mr. Alexi and Thomas. I see there's another question from Brianna Hathaway.
Hi, Nick. Thank you. I'm just reading out a question from the chat. So someone asked, how will the lack of ID be solved?
Sorry, is that question specific to Mr. Alexi?
Ouais.
I
Le
guess I would
problème,
like to assume that.
le problème d'identité est un problème complexe que nous ne saurons pas résoudre entièrement dans le cadre du projet. Mais toutefois, nous prenons un ensemble de mesures pour voir comment on peut atténuer l'impact de ce problème d'identification.
The issue of IDs is very complex and will not be fully solved during this project. However, the project is taking some measure to mitigate this issue.
Et deux aspects, c'est que un des premiers aspects qui était la liaison des numéros de téléphone à une identité spécifique, c'est que le gouvernement a pris des mesures en ce sens pour pousser les compagnies à enregistrer les bénéficiaires, les utilisateurs de téléphone avec une identité quelconque.
The first aspect is that regarding this issue of this connection between SIM card, so phone numbers and ID, the government started to take some steps to force people to give their data, their ID, if they want to open an account.
La deuxième chose pour les pièces d'identité, c'est que au niveau du projet, nous essayons d'identifier dans la base de données que nous disposons les ménages qui ne disposent pas de pièces d'identité et nous sommes en train de travailler avec l'organisme chargé de produire les codes d'identification nationale pour voir comment on peut mener une campagne pour distribuer des cartes d'identification aux bénéficiaires et potentiellement à d'autres ménages qui en ont besoin dans le département de la Grande-Est.
Another aspect is that the project is working to identify the household without any IDs and working with the governmental institution in charge of the issue to organize some massive campaigns to identify people and distribute IDs to the beneficiaries and also to other households of the same areas, communities.
Ce sera fait aussi à travers une campagne de communication et de sensibilisation pour intéresser les citoyens qui n'ont pas de carte d'identification à se faire enregistrer au niveau de l'organisme public en charge de la question.
This will be done through a large communication campaign to inform and incentivize the population to register in this ministry in charge or the organization in charge of the identification.
Et là, il faut seulement retenir aussi, comme il s'agit d'un projet pilote, ce problème, on pourra appliquer cette solution au niveau du département de la Grande-Est.
And also to remember that since it's only a pilot project, these campaigns, this issue will only be solved at the Grand Anse department level.
Okay, thank you very much for that, Mr. Alexi. I see we now have another question from Vijay Ganga Prasad. Please feel free to
Thank you very much. Thank you very much, Nicholas. And I want to firstly commend the organizers for this event. I think it is a very useful one and very timely. Additionally, Caribbean countries share much more in common than a geographical space. Our vulnerabilities are almost homogeneous, and there's so much that we can learn from each other as we go forward. This question is for our counterpart in St. Lucia. I noted the use of the vulnerability index as well as the PMT for targeting persons for enrollment in social protection programs. Um, having done some work down here and that, could we get a little more insight into how it is used, the variables that are measured, as well as whether or not any research or any studies have been done to determine the level of inclusion and exclusion errors based on the methodology that they are using? Thank you.
Good morning again. Thank you. This is a very big question and requires a lot of discussion. The vulnerability index was also piloted in St. Lucia, and it's from that we got that in the information in terms of who should receive assistance. We well, in terms of just now, yeah. In terms of the SLNet 3.0, this is our targeting tool, as I indicated earlier. And we look at several areas. It's a multidimensional tool that looks at poverty across the line. The vulnerability index looks at the hazard vulnerability. I'm trying to get a presentation, actually, all the information, so I wouldn't shortchange you here. Yeah, just give me a second. Yes, it looks at the resilience capacity, socioeconomic deprivation, and that the socioeconomic deprivation you will get from the SLNet 3.0 and some of the questions also. So we use 2 different questionnaires to get that type of information. And as I told you, it was from persons, our population was from persons who were affected during Hurricane Elsa. So we had a hazard susceptibility, resilience capacity, socioeconomic deprivation. So it was a very technical tool that was used. We look at access to telephones, access to healthcare. We also look at access to medical care, hurricane shelters. So a number of variables were used to determine the vulnerability index. And this in itself is a different presentation. It's quite lengthy in terms of explaining what we did. It's a very technical area also. I don't know if I answered your.
Well, I'll say this. I think I agree. I fully agree that this would require some more extensive kind of discussion. And I would hope that the organizers could facilitate um, some avenues to engage where person might have an interest in engaging each other on topics of interest, mutual interest. It will be very helpful as we move forward. Yeah, and I know that for the time it might take for you to fully explain might take up our entire workshop here. So I'm pleased with your response to now. Yeah.
Also, I have done that presentation. I think WFP had another workshop, like similar workshop, and I did present on the vulnerability index for shock responses, social protection in St. Lucia. So that was a presentation that I did not too long ago. And perhaps I can share that with you, and we could exchange numbers and we could share that information. We could have a discussion.
Really, really appreciate that. Really appreciate that.
Okay.
Thank you very much, Dr. Dallaire. I see there's another question in the chat. It's from Daphne Hodge, and I guess I would actually pose this question to P.S. Burton to answer first. And the question is each country using MIS systems for social protection programs for tracking and analysis? We only have a few more minutes, so let P.S. Burton start, then Dr. Dallaire, and then finish with Mr. Alexi. And I'll repeat the question. Is each country using MIS systems for social protection programs for tracking and analysis? Over to you, P.S. Burton.
Okay, so we are just at present preparing to do an MIS for Dominica because we have approximately 39 different social protection programs, and so we're trying to see how we can consolidate and put everything together as one program instead of having so much duplication. So we are just now in the process of commencing that process of doing an MIS. So that's my answer.
Thank you very much, P.S. Burton. Dr. Delaire?
Yes, as I indicated earlier, we are in the process of, well, our consultant should be in by next month for our social information system. And it includes the establishment of our social registry, beneficiaries registry, and so on. And these we will do under the Human Capital Resilience Project. And so, yes, it is part of our holistic reform of our social protection system.
Thank you very much. And Mr. Alexi?
Thomas, j'ai perdu cette question. Tu as pu noter pour moi?
No, sorry, could you please repeat the question? I don't know,
No
so Mr.
problem.
Alexei.
Is each country using MIS systems for social protection programs for tracking and analysis?
Allez-y, Monsieur Alexis. Est-ce que le pays utilise un système d'information pour le suivi et l'analyse des données?
Oui, dans le cadre du projet que nous avons actuellement, c'est que nous sommes en train de développer un MAS, mais nous n'avons pas encore un système spécifique au gouvernement. Mais dans le système qu'on aura développé, ce sera comme un système multifinalitaire qui nous permettra à la fois d'avoir le registre social, un système pour gérer les paiements et qui intégrera aussi la gestion, un système pour gérer les plaintes.
At the moment, the ministry doesn't have a specific system MIS in place. However, they are working on it, and this system will have to join the different aspects of the project, which is the social registry that is already in place, together with a national payment system, and also to be linked with the complaints system, complaint mechanism. Over.
Pour l'instant, nous utilisons le système existant au niveau du PAM pour pouvoir gérer les paiements, mais après nous avons un mécanisme de gestion des plaintes plutôt pas encore mis sous forme électronique.
At the moment, the ministry is using WFP system to manage the payments, and there is a complaint mechanism as well, but not electronic, not digital system. Over.
Thank you very much for your responses. Unfortunately, we have to bring this session to a close. On behalf of the World Food Programme, I'd like again to thank P.S. Burton, Dr. Delaire, as well as Mr. Alexi and yourself, Mr. DeBrer, in providing these insightful presentations. As Mr. Ganga Prasad would have kind of mentioned, you would have seen the commonalities across the different countries and the programs as well, both in terms of advantages and limitations with these pilots. And we do look forward and hope that with this session and this conference, that it fosters the relationship for us to continue to learn from each other and see how best we can move forward as each country and program advances their processes as moving towards digitalization. I thank you very much for your participation, and I do look forward to seeing you in the rest of the sessions. Thank you again, and take care, everybody.